Alzheimer disease, AD, is a progressive neurodegenerative disease that predominantly affects older adults. This leads to decreased cognitive function, memory, and behavior. Also, there is currently no cure. Treatment options aim to relieve symptoms, slow disease progression, and improve the quality of life for both patients and caregivers. The main medications used for Alzheimer's disease fall into two categories: acetylcholinesterase inhibitors. This group includes donepezil, galantamine, and rivastigmine. They work by increasing levels of acetylcholine, a crucial neurotransmitter for memory and learning that is deficient in Alzheimer's brain. By increasing acetylcholine levels, these drugs can help improve communication between brain cells, potentially stabilizing or slightly improving cognitive function. Metantine. This drug works differently. It regulates glutamate, another neurotransmitter involved in learning and memory. In Alzheimer's disease, excess glutamate can damage and kill neurons. Metantine blocks the effects of excess glutamate, potentially helping to control or delay the progression of cognitive symptoms. These medications are usually given orally or through a patch and are most effective in the early stages of the disease, before significant neurodegeneration occurs. The duration of treatment is usually indefinite, as long as the medications are tolerated and provide some benefit. This means you may continue to take them for several years, depending on your individual situation. The choice of medication depends on several factors, including the stage of the disease, individual response, and possible side effects. In early and mid-stage disease, acetylcholinesterase inhibitors are often first-line treatment because of their ability to modestly improve cognitive function and generally well-tolerated side effects. Donepezil is generally the preferred first-line drug because of its once-daily dosing and proven effectiveness. In later stages, metantine can be used alone or in combination with acetylcholinesterase inhibitors in moderate to severe stages. It may not significantly improve cognitive function, but it may help manage behavioral symptoms and potentially slow the progression of the disease. Here are some additional considerations regarding treatment duration and changes. Over time, the effectiveness of these drugs may decrease as the disease progression. Your doctor will evaluate whether adjustments are necessary. If you experience unpleasant side effects, your doctor may adjust your dosage or try another medicine in the same class to find a better one. Switching from acetylcholinesterase inhibitors to memantine may be considered, but this is not common practice. The decision will depend on your individual response and the stage of your disease. Despite their benefits, these treatments have limitations. Their effectiveness may vary significantly between individuals. They primarily slow the progression of the disease rather than reverse it. Increasing dosage to increase effectiveness may lead to side effects, which will complicate the treatment of the disease. These drugs are often prescribed later when they may be less effective due to advanced neurodegeneration. The blood-brain barrier prevents many drugs from directly entering the brain, limiting their effects. Lack of treatment and problems with early diagnosis highlight the importance of preventive and neuroprotective strategies. These strategies aim to slow the neurodegenerative process by reversing underlying neuronal dysfunction in axons, dendrites, and synapses, potentially reducing the risk of developing Alzheimer's disease. While current medication offer hope for treating Alzheimer's disease, ongoing research into better treatments and early diagnosis is critical. In addition, maintaining a healthy lifestyle with regular mental and physical experience and maintaining social connection is important for managing the risk of developing Alzheimer's disease. Remember that a healthy lifestyle cannot completely prevent Alzheimer's disease, but it can improve cognitive health and potentially delay the onset or progression of the disease. Always consult with your healthcare provider to develop a personalized treatment plan based on your individual needs and stage of disease. They can help you find the most appropriate medications, make lifestyle changes, and develop strategies to effectively treat Alzheimer's disease. Thanks for likes and sharing.